Section 1.2.3 Evolution of Early Childhood Care and Education in India. ECCE has evolved significantly over the past several decades. While early childhood has always had a special cultural and social place in India, it has gained greater focus in education systems and policies over the years. Traditionally, early education was family based and focused on the learning of values and social skills in children. With changes in the socio cultural and demographic milieu, early childhood education in India has moved from socio cultural practices, which were often informal, to a more formalized institution based setting. Some of the earliest pioneers of early childhood education in modern India have been Gijubhai Badheka and Tarabai Modak. They were amongst the first Indians in modern education to conceptualize a child centered approach to the care and education of young children. They were of the view that education must be imparted in the child's mother tongue and should be connected with the child's social and cultural environment, and the community should be actively involved in the learning process. Since language is the true vehicle of self expression, children can freely express their thoughts in the mother tongue or local language. Gijubhai focused on story based curricula, especially for socio emotional and language learning. Contextualizing the views of early education pioneer Maria Montessori, he said, early childhood education is the first and foremost step towards building a great nation. While Tarabai Modak advocated formal organizing for community based early childhood education programs. Although models of kindergarten based on ideas of early education thinker Friedrich Froebel were established in certain towns by the English missionaries in the late 19th century, the first indigenous preschool was set by Gijubhai Badheka in 1916. Tarabai Modak established the Nutan Bal Shikshan Sangha, New Childhood Education Society, in 1925. The Vikaswadi Center in Kosbat, established by Tarabai Modak, later became one of the inspiring settings for developing community ECCE programs in the country. With Mahatma Gandhi's emerging ideas of pre basic and basic education and Montessori's visit to India in 1939, the foundations for organized early childhood education were further strengthened. Section 1.2.3.1 Early Education in Independent India. Our Constitution provides several fundamental rights and directives that address the welfare and development of children. The Committee for Early Childhood Education in 1953 emphasized the need for establishing preschools within primary school settings. Under a scheme of the Central Social Welfare Board, several organizations supported the establishment of balwadis in rural areas to provide services that integrated education, health, and care for families and communities. In 1963-64, several provisions were recommended by the Committee on Child Care to ensure that education in the early years was relevant in the Indian context. The Kothari Commission 1964 recommended the establishment of preschool centers in the country, with the National Policy on Education and setting up of the National Children's Board. Focus on early childhood education as a significant goal that contributes to later schooling was established. Section 1.2.3.2 Integrated Child Development Scheme. The Integrated Child Development Scheme (ICDS) was launched in 1975 in 33 experimental blocks in the country. The program reflected a shift in the focus from welfare-based to development-based services and considering children as a national resource. For many years now, ICDS is the largest and the most comprehensive program for ECCE services in the world. The Anganwadis under the ICDS provide health, education, and nutrition services to children less than 6 years old, mothers, and adolescents in the remotest of areas throughout the country. The 6 services provided under ICDS are supplementary nutrition, preschool education, nutrition and health education, immunization, health checkups, and referral services. The 1986 National Policy on Education viewed ECCE as significant to human resource development. As per the policy, it should act as a feeder to primary education and a support system for working women. With greater financial allocation and a focus on integrated and play based learning for children, the policy accelerated developments in the early education domain. In order to establish training and support needs of the various functionaries, government bodies such as the National Council of Educational Research and Training, that is NCERT, and the National Institute of Public Cooperation and Child Development, that is NIPCCD, began several research projects across the country to determine the reach and effectiveness of these programs. Support systems were set up by the NIPCCD and the National Council for Teacher Education (NCTE) to provide pre-service and in-service training to teachers. Over the years, these efforts have led to significant improvements in ECCE. However, there have also been gaps in implementation and monitoring of the services that have compromised the standards and goals set by these policies and programs. Section 1.2.3.3, the last 2 decades. ECCE came under the purview of the work of the Ministry of Women and Child Development in 2006. Under MWCD, the National Early Childhood Care and Education Policy 2013 was formulated, which became the first policy exclusively for children in the early years. It had a vision to promote inclusive, equitable, and contextualized opportunities for the optimal development and active learning capacities of the children below 6 years of age. This was followed by a National Early Childhood Care and Education Curriculum Framework in 2014, brought our MWCD that made significant commitments to improving education in the early years. It has further strengthened the country's commitment to providing universal access and quality care and education to young children. In 2019, the NCERT developed a preschool curriculum for 3 years of preschool education, along with guidelines for preschool education. The most recent has been the Transformative NEP 2020, which articulates a very clear goal. Every child in the age range of 3 to 8 years must have access to free, safe, high quality, developmentally appropriate early childhood care and education by the year 2025.